Why are healthcare professionals backing peace of mind? Stay tuned. If you're new to the concept of peace of mind with our medical advocacy and transportation service, I'm sure it makes sense to you that the adult children find it most beneficial. They're able to stay working at their jobs and knowing that a registered nurse is accompanying their loved one to and from their appointments, and they know that they'll be receiving a document professionally done by a registered nurse that they'll be able to receive after the appointment just to stay involved and know what's going on regarding their loved one's health care. But these aren't the only people that are seeing the value that peace of mind provides. The feedback we have received from case managers of hospitals as well as physicians has been absolutely wonderful. And why is that? Well, case managers of hospitals are seeing a lot of readmission rates. Now, some of these readmission rates are simply due to the patient not being able to get to their appointments because they don't have a means of transportation, or maybe they forgot that they had an appointment coming up. Whatever the case, they're not having a form of transportation to their appointments, therefore they're not coming in, and then they're having to reschedule their appointments for a later time. The other side of this coin is that many of those who go to the doctor's appointment and sit in their doctor's visit and just listen to what the physician says, they're leaving, and within an hour later, questions may be coming up of, oh, I forgot to ask that. And they may be thinking, well, what did my doctor say again? What do I have to do? And there's just confusion and forgetfulness. And this happens amongst anyone and everyone at different times. And so what peace of mind is helping with the case managers is making sure not only that patients are getting to their appointments when the time is required, but they're also being helped and guided through the appointment so that when they get out of the appointment, they can remember what was said and what was done and what needs to be done moving forward. Now, physicians are also seeing this, as many of them, as they speak to their patients, they know that some of their patients just aren't understanding what they're saying, and they're getting confused, and they know that some of them know that some of their patients, once they leave the appointment, they're not at all going to remember what's going on. So it's not even from the patient's perspective, but it's also the physician. So peace of mind is really helping the healthcare realm in general with these readmission rates. We're helping the adult children stay working so that they can get the bills and get the payments they need to be able to provide for their family. And we're also caring for the loved ones and making sure that they are moving forward knowing what is expected from them in regards to what was said within each one of their appointments. So if you have any questions, feel free to reach us at services@pofmusa.com. Until then, enjoy the rest of your day, and I'll talk to you soon. Take care. Bye-bye.